was actually just reading about the Magnolia Project.
Yeah.
My sister's in Jacksonville.
79 and nice. Fatherhood Pride, Jacksonville, Florida hot.
That's a good description, I think, in our whole state today.
Hot. Oh, some of y'all
Mhm.
said 70. I feel like I saw 70. Maybe not. Nurse Family Partnership, Health Department, West Palm Beach. Awesome. Well, thanks so much for joining, everybody. Yeah, everybody is muted, Rosa. Everybody's automatically muted except me and Jennifer. And so if you have questions throughout the presentation and things like that, so we'll go through a couple of housekeeping things before we dive right in. We have a lot to cover today in 60 minutes, so we really, really do appreciate your time today, giving up your lunch hour and things like that. Feel free to continue putting in the chat where you're from, what organization you represent, and it's just something we love to know and learn more about the state. And this is being recorded, so after the webinar, either today or tomorrow, you will get the recording to share with those that maybe couldn't join today. You'll also get a PDF of the slide deck, and you'll also get some other resources that we'll talk about today too, all in an email. So look for that to come to your inbox here within the next 24 hours or so. Everybody is automatically muted. So if you have questions as we go throughout the presentation today, feel free to put them just in the chat box. We might answer as we go, but we'll address them all at the end, or if I happen to catch one during the time. But I don't want you to forget it, basically. So go ahead and put it in the chat, and if we get to it, throughout the presentation, awesome. If not, we'll be sure to stay on and address that too. So we're going to go ahead and jump right in. What you see on your screen are just some of the babies that have been saved with Count the Kicks information and education, some of those beautiful faces. So I wanted to start off with that so we could see some of those wonderful baby faces that we all love. I really wanted to give a huge shout out to the Florida Department of Health. It's because of a partnership with the Florida Department of Health that we are able to do this training today, this webinar with Jennifer, and that you can access all the free materials that we're going to talk about today. So we've been working with them for a couple of years. They're amazing partners, and we're just really happy to be connected with the Florida Department of Health. So thanks to them for bringing this to your great state to save babies from preventable stillbirth. And a little bit more about us, your presenters today. My name is Megan Ockett. I am the program director with Healthy Birthday, Inc., which is the nonprofit organization that created Count the Kicks, which is obviously what we're talking about today, the evidence-based stillbirth prevention program. My background is in public health. I've had over 15 years experience in public health. I really am passionate about maternal child health, especially as it relates to systems level change. So throughout the presentation, I want you to be thinking about how you can take this and integrate it into your system. And we'll talk about that too a little bit more, but that's really what I want you to take away too today is not only are you now comfortable talking about stillbirth and stillbirth prevention and the evidence-based tools and resources, but then how can you integrate this so that all your patients, all your members, all your expectant parents you serve learn about this. So I am based in Iowa. We are a national organization, so that's why you hear me talk about the temperature and things like that. But I am so happy to be here today with you alongside my colleague and friend, Jennifer. Jennifer, would you like to introduce yourself?
I would love to. Hi, everyone. My name is Jennifer McKennis. I am your Florida ambassador for the state, for Count the Kicks for the state. So what that means is at the end of this presentation, if you need any support in how to implement Count the Kicks within your organization, if you're having trouble ordering materials, I am a person that is there to help you. I found Count the Kicks about 6 months ago. And unfortunately, I found it because I delivered my stillborn son 2 years ago, my Jonah. And this was after 7 years of trying to conceive, multiple IVFs, and we were finally pregnant with what we thought was our miracle rainbow baby. And at 30 weeks, one day, I discovered that I just wasn't feeling any fetal movement. And I went into labor and delivery, and we learned that he no longer had a heartbeat. And at the time, we weren't given an explanation. We were just told sometimes these things just happen. But we now know 18 months later, we had a specialist review slides of our placenta, and they were able to identify that we had a cord accident. We had clots in the umbilical cord and evidence of cord compression, repeated cord compression. And while those two things are not biologically preventable, we did have two early warning signs. The first one is that we had 1 week prior, we had an ultrasound at a new MFM's office, someone we'd never seen before. And we do have an ultrasound image showing that one of the arteries had stopped functioning. So it looked like we had a 2-vessel umbilical cord, when in fact, throughout the duration of my pregnancy, we actually had 3 vessels. The doctor and ultrasound tech didn't realize that was a change, and no one shared that information with us. But the second early warning sign is really the reason why I'm here today. It is the reason why I volunteer with Count the Kicks. 48 hours before I delivered my son, I had a significant change in fetal movement. I had a strong surge in the strength of kicks and in the frequency of kicks. It was very sudden. And we had no idea that that could be a sign that my son was in fetal distress. We were just thrilled. I was calling my husband over. We were feeling my belly. At the time, all I knew about tracking fetal movement was actually what I had learned from reading books and using pregnancy apps. In fact, what I had learned through those was inaccurate and it was incomplete. And unfortunately, none of my care providers during my pregnancy educated me on properly tracking fetal movement. So I do believe that had I been using Count the Kicks, that maybe my son would be here today. So I learned about the great work that Count the Kicks had done in the state of Iowa. You're going to hear all about our research and our evidence showing that this program really works. And it is a privilege to get to be here today. All of you are the people that are at the front line, that are working with expectant parents. And I just want to work alongside you in empowering our parents to have the knowledge that they need to be able to keep track of their baby's health. And if we can save babies, that would just be amazing. I know my Jonah would be proud if we can save babies. So thanks, Megan.
Yeah, no, thank you for sharing your story, Jonah's story. And it's absolutely a privilege to be working alongside you in memory and honor of Jonah. So thank you for sharing that with everybody. And so one of the most powerful and effective ways that we've found to educate expectant parents is using that mom-to-mom storytelling. So even, the story of Jonah and those baby faces and everything, that's going to stick with you today. So we wanted to share this video with you from Good Morning America that aired in 2017 about baby Ruby. So let's go ahead and watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Yeah, so we're still hearing those testimonials from that ripple effect of baby Ruby from 2017. So it is pretty neat. And you can always share, we have YouTube videos out there. You can always share those types of testimonials with your members, your patients. So what is Count the Kicks? Count the Kicks is an evidence-based stillbirth prevention program. It educates expectant parents on the importance of tracking fetal movement, and it empowers expectant parents to speak up to providers if there's a concern. And so just to make sure we level set, we're all on the same field when we're talking about definitions here. And I'm sure we all know because we're all in the public health sphere, medical community. But today we're talking about stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term, and you can see those definitions there. Miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy, and infant mortality is the death of an infant before his or her first birthday. So there tends to be some confusion between stillbirth and infant mortality, but they are two separate tragedies that exist. And so on average, we lose around 22,300 babies every year to stillbirth in the United States. Compared to infant mortality, on average, we lose around 20,000 infants. And that's not to underscore the tragedy and devastation that infant mortality is, but it's to just give you an idea of just how impactful and important it is to talk about stillbirth and stillbirth prevention. We need to get to a point where we're talking about stillbirth and stillbirth prevention like we are talking about the Back to Sleep campaign and things like that, because it's so taboo. What we want to do today is give you the tools and resources to be able and feel comfortable talking about it so that we can address it and decrease those stillbirth numbers across the United States. So speaking of stillbirth data across the United States, Jennifer is going to share a little bit more about the national data and Florida data.
All right, so you can see up at the top that families are 6.5 times more likely to lose a baby to stillbirth than to SIDS. Yet every single new parent learns and has a conversation with the pediatrician over how to safely put their baby to bed to reduce the chance of SIDS. But in most pregnancies, that word stillbirth is never even brought up. So the importance of having a conversation about stillbirth prevention is critical because, as you can see, these statistics are staggering. I thought that our stillbirth was a rare occurrence until I learned about the data. So you can see that 1 in 173 pregnancies ends in stillbirth in the United States. But below that, you can actually see the breakdown by race. And these disparities continue to persist. It's really unacceptable. If you look at the stillbirth rate for Black expectant parents, 1 in 97 pregnancies ends in a stillbirth. Now compare that to white expectant parents, 1 in 211. So Black expectant parents have over 2 times the chance of having a stillbirth. You can see Indigenous pregnancies, 1 in 128. You can see Hispanic, 1 in 205. And then this is actually our newest set of data where we have separated Asian expectant parents from Native Hawaiian and other Pacific Islanders. And it has really highlighted that our Native Hawaiian and Pacific Islander has the highest rate of stillbirth. So it's important that we find ways to overcome this disparity. Okay, so that's the data for the US. Let's actually look at Florida. And I want you to look at that large number in the center of your screen. That is how many stillbirths we have on average in the state of Florida every single year, 1,534. And I just want you to imagine that's the number of families in our state every year that have their lives completely upended. I speak from experience here. Everything about my life is different. The day before I delivered my son and learned that he had passed away, and every day afterwards. And so if you look at at the top, you can see our stillbirth rate in Florida is 6.93 per every 1,000 live births. So if we compare that and break that down by race and ethnicity, on the right side, you can see our Black expectant parents are seeing 10.3 stillbirths per every 1,000 live births compared to Hispanic, which is 5.6, white, which is 5.2. Again, we are seeing a 2 times higher rate of having a stillbirth in the state of Florida. It's very similar to our US data. If you look at that graph on the top left, I know Megan's going to give a lot more data soon comparing the US to Florida, to Iowa, excuse me. But if you look at Florida, we are the red line up at the top. We have some work to do. We've remained relatively stagnant, and we launched Count the Kicks here in 2020, but we still have a lot of work to do to make sure that this information is available for every expectant parent in our state. And if we were to save 1 in 3 babies, and evidence, research is showing that we can save 1 in 3 babies by implementing Count the Kicks, then that would be 491 babies on average every single year. I would give anything in the world to be one of those families.
Thanks,
All right,
Jennifer.
now,
Yeah, sorry. I was just going to say, I have to give a shout out to the Florida Department of Health and their EPI team. They have an amazing website where all of you stated kind of the counties you represent or the counties you work and live in. They have data, fetal death data, stillbirth data by county. So you can go and search that through their website as well. I see there's a hand raised. Everybody's automatically muted. So go ahead. If you have a question, you can go ahead and put it in the chat and we can look at that, and you might be able to get your question answered here as we go out, or we'll definitely answer it at the end. So I'll keep going because I know we're on limited time, but go ahead and ask your question in the chat. So I just want to touch on why there are such large disparities for stillbirth and think through what are things that you can do, that you can implement to impact the stillbirth rate, especially among those most at risk, those marginalized communities. So researchers point to the following as causes for disparities: systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it, has led to real and pervasive health issues. Epigenetics, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, linking to maternal stress, and experts say Black women are less likely than other races to receive early treatment of those conditions, access to healthcare, socioeconomic barriers. But it's important to note that research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So here are some of the things that we're doing to reduce disparities that exist in persistent stillbirth. And what are some things that you could do? Well, we're listening. We continually have community conversations, focus groups, and based on those community conversations, we improve programming with those lived experiences, elevating voices of color. We have an app in 16 languages. 2 of those languages, Portuguese and Haitian Creole, are due to the fact that community members in Florida spoke up and said, I need this information in this language. We need this type of information in Haitian Creole and Portuguese. So we listen and we take that back to the health department who takes it and listens and says, yes, like, let's make sure we get our community members what they need. And so please feel free to let us know, what are some of the things that you need? You're the boots on the ground. How can we make this easier for you to implement? We have culturally appropriate educational materials. We have lots of videos and printed educational materials and FAQs in multiple languages. We have a health equity team, a team that's continually looking at the data, the research, and saying, how else can we reach those most at risk of experiencing a stillbirth? We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. And we're working community outreach beyond the healthcare setting. So we've done things, faith-based outreach and beauty salon outreach and social media and digital marketing and things like that, rural health outreach with wristbands. So there's just a lot of different ways that we've improved our programming based on what we're hearing from the community. So let's spend a couple minutes talking about the research and evidence behind Count the Kicks. And so Jennifer mentioned it earlier about that 1 in 3 chance of saving a baby from preventable stillbirth. And so I want to talk about that here for a minute. And what Count the Kicks is based off of is this evidence. This is the one that started it all. There's other evidence on the importance of fetal movement monitoring, but this specific journal, this research out of Norway that showed when educated expectant parents on getting to know what's normal for their baby, and they were educated on how to speak up if they noticed a change, that among this cohort of women in the study, there was a 30% reduction in the Norway stillbirth rate. So our founders, who are all 5 Central Iowa women, who all experienced stillbirth or infant death in the early 2000s, they didn't know each other at the time of their loss. They got together through pastors and friends, and they were at a public health conference and heard about this research, and they said, that's amazing. We can do that. Kit counting's been around for a long time, but the tools and resources to easily talk about stillbirth prevention and fetal movement monitoring, the tools and resources for parents to understand the importance and why they should be doing this, that's what we can create. We can create an empowering, uplifting, bright, colorful program that can do this. And that's what they did in 2008. That's when they officially launched Count the Kicks of what you know today. So this is the study that it's based off of. And so when we launched in 2008, from 2008 to 2018, we saw in Iowa a 32% reduction in the number of stillbirths. In the first 5 years of the campaign, the African-American stillbirth rate decreased around 39%. And we've stayed at a significant lower level ever since 2008. There's a couple outliers in there. You can see things like a syphilis outbreak, a pandemic that can impact the stillbirth rate. But what's important is that trend line. We are continually going to that trend, continuing downward trend. This is what we want to see happen in Florida. We want to see that dashed line go down as we inundate and implement this in more areas of your state. So when we talk about the research, you guys are the first ones to hear this. This literally just got, this is hot off the press. It just got off announced on Sunday night, actually. We have research that was published by an well-known international stillbirth researcher, Dr. Alexander Heasel from Tommy's Research Center in the University of Manchester, UK, who looked at the Count the Kicks implementation and in Iowa between 2008 and 2018, and he compared it to other states surrounding Iowa that didn't have Count the Kicks during that time frame. And so this quote was taken from the research, and it's in BJOG, which is an international journal of obstetric and gynecology. He says, to be able to demonstrate that we have a rate going down at 1% every 3 months in Iowa, which is much faster than the United States population average, this tells us something's happening in Iowa that's not happening in the rest of the United States. They believe that this large observational study demonstrates a reduction of stillbirths in Iowa that cannot be accounted for by other changes in risk factors for stillbirth. So we actually have this 9-minute video that's fantastic. It gives you a lot more information on the research. I'm just going to play one clip of it from a provider, an SMFM specialist, who talks about the implementation and integration of Count the Kicks. But I will share this video with you in the email that goes out so you can watch it. It's also on our website. But I really wanted to highlight this one quote from Dr. Neil Monsager, who talks about best practice evidence base of Count the Kicks in Iowa. So let's watch.
And that's borne out.
He comes in right around, here we go. I just want to play this for you guys.
It's now become standard of care, certainly a community standard of care here in Iowa, that physicians provide this information to their patients at 28 weeks. And if you don't do that, you're practicing outside the standard of care. So in my opinion, you're actually putting yourself at more risk as a provider for malpractice if you're not engaging Count the Kicks and not engaging that discussion with the patient.
To me, it's a no-brainer. It's like you hear this, it's such a simple message, and yet the science behind it is there. And then when you look at this new research, it's like, once again, telling you of this is so important.
So I'll stop there because it's 9 minutes. So we don't have that much time, but I'm super excited to share that with you all today. And like I said, I'll share this video with you all in the follow-up email. So let's go to the next slide. So additional research and evidence that I want to talk about, and we have a whole evidence page on our website where you can read through fetal movement monitoring, research out there, and everything you ever wanted to know. But last April, we published a white paper that shows the link between stillbirth and maternal mortality and morbidity. And I think this is a fairly newer information that came out that if you have a stillbirth, you're 4 times more likely to die as well. So this report includes firsthand accounts from women who share how speaking up about a change in their baby's movement not only helps save their baby and have a safer arrival, but also identified and addressed pregnancy complications that put their own life at risk. So again, I will send this in the follow-up, but it's also on our website. So you can go and share that with your team. And then I want to address probably the elephant in the room where I think you're all probably thinking this is, what about the side effects? Is this going to increase anxiety in my patients and partners and community members? Am I just going to have an increase in hospital utilization? And I understand that as humans, we tend to go to that most extreme case scenario, right? And so I'm here to tell you that that doesn't happen. There's no increase in hospital utilization. This other research study stated that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And I'll tell you why in a minute. He also stated that decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. There's a worse outcome in pregnancies with reduced fetal movement, with one study demonstrating the highest incident of poor outcomes in a small for gestational age fetus. And then talking about the anxiety, does this increase anxiety in pregnant people? It doesn't. We have research out there, and we've done our own research through the Des Moines University and the Harkin Institute of looking at our thousands of app users and finding that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. Because what happens now, especially with our app, which Jennifer is going to talk about, and our education, is you now have a highly educated individual that understands what's normal for her baby in terms of movement, so that they can speak up to their provider and say, that's not my baby's normal. My baby's normal has been, 10 movements in 15 minutes, not 10 movements in an hour and 15 minutes. I'm going to talk to my provider and see what they want me to do. And then the provider will have you come in and do the proper protocol pathway that they should do when anybody comes in with a change in fetal movement. So again, there's lots of other research out there. We also know that maternal fetal movement monitoring has additional benefits, like things like reduction of preterm birth rate, fetal growth restrictions are identified earlier. We talked about how women who have stillbirths are substantially higher risk for severe maternal mortality than women who have live births. And then this quote from the research study I like, where he says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. I think there's also that common concern that, you're going to get all these people coming in with decreased fetal movement or a change in fetal movement, and it's going to increase C-section rates. And that has not happened in Iowa. That's not known to happen because, again, this is a way to check on baby, right? It's not like somebody comes in and it's an automatic C-section. You're doing additional things that you need to make sure baby and mom are okay. So now I'm going to send it over to Jennifer to talk about the app and how to implement Count the Kicks into your workflow.
Okay, so I did see a couple questions in the chat. What is Count the Kicks? It's a public health campaign to train our parents to track fetal movement. And why is movement so important? Well, it's really the only way that baby can communicate with its parent before birth. And so what we want to train our parents to do is to learn what their baby's normal pattern is. And any change in that baby's normal pattern could be an early sign. Sometimes it's the only sign that baby might be in distress. I mentioned earlier that I had that change in pattern 48 hours before. I was a high-risk pregnancy. I was being monitored very frequently. And this happened pretty suddenly for me. And so the movement of our baby is very important. And in addition to getting to know the normal, we want to make sure that our patients know that it's okay for them to speak up. We want to make sure they know that if if they are reaching out to their provider, they should be sharing if they're noticing any changes in movement. All right, so what actually is the Count the Kicks? So Count the Kicks is going to be 2 different versions of tools that we offer. Megan, can you jump to the next slide for me?
Yeah.
Thank you so much. Okay, so there's 2 different versions of kick counting, but what actually is the message that we want to send to our parents? Well, we want them to start counting movements at 28 weeks is what's recommended by ACOG for a normal pregnancy. If it is a high-risk pregnancy or a pregnancy with multiples, they recommend that we start at 26 weeks. So we are following the recommendation from ACOG. And the reason why they've chosen that time frame is research is showing that that's when baby has established a consistent pattern. So mom can now feel, can now track those movements and get to understand what their normal pattern is. What is it that we are going to count as a movement? Anything that's a roll, a kick, a jab, a push. The one thing we don't include are hiccups because those are involuntary movements. And when they notice their normal pattern, we want them to be on the lookout for a deviation from that pattern. And that deviation can take the form of 3 different things. It could be reduced number of kicks. It could be a reduction in the strength of kicks, or as in my case, it could be a sudden wild increase in the strengths of our kicks. All right, so let's actually get into the tools that we can use. And how would you be training your patients to use Count the Kicks? So I mentioned that there are 2 different versions. We do have downloadable paper charts. That's kind of the old school method, but some of our patients are old school or don't have regular access to the internet, depending on their home and work environments. So more likely your patients would be using our Count the Kicks app. It is free. There are no advertisements. It's really important to us that mom does not have any kind of distraction when she is going to start her kick counting. And what we want to train them to do is starting at that 26-week or that 28-week mark, they're going to count their baby's movements every single day. And we recommend they choose the same time during the day because baby tends to behave the same way at the same time. For example, okay, after dinner, I'm now relaxing. We recommend that the parent lay down, put their feet up. It is a very nice excuse for a very exhausted, expectant parent to take a break. And now we're going to ask them to start counting their kicks. And you're going to see a video in a moment that's going to show the use of the app, but the app will have them tap. You see those cute little feet icons on your screen here. They're going to tap that little foot every time they feel a kick. And when they get to 10 movements, the app is going to keep track of how long it took for them to get to 10 movements. And if any of you on the call, you all interact with parents, but if you have been, had your own pregnancy, you know that pregnancy brain is a real thing. I can vouch for that. And so this app will keep track of that time so that mom doesn't have to keep track of that time on their own. And after a few days of tracking fetal movement, they're going to start to see a pattern. It's an average amount of time that it takes to get to 10. And we want them to continue tracking every day. If they notice a change, we recommend call your provider right away if you notice a change. If you, for some reason, can't reach your provider, they, of course, can go, hospitals are available 24/7, but we, recommend that they talk to their care provider right away. Speaking up is so important. Knowing you're normal and recognizing a difference is wonderful, but if they don't speak up, then we're not helping baby. And minutes really do matter when it comes to saving babies. So we want to encourage our parents to advocate for themselves. And we've got a great video Megan's going to play.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Okay, so I'm going to talk a little bit about the features, but what I would love for you to do right now, if you're in your office or in home, I would love for you to go to your phone. I would love for you to go to your store, Apple Store, Google Store, whatever platform you use. And while I'm talking about the app, I would love for you to download the app because you will see how easy it is to use this app and how easy it is to train a parent on how to use it. Usually when I'm training someone, it takes me 1 minute or less to show them how to use it. It's very intuitive. And I want you to get comfortable with how the app works. So it's called Count the Kicks. So when you go to your app store, look up Count the Kicks, you'll see our cute little clock on there, you'll see the logo. And I'm going to talk a little bit about the features of the app. So as I mentioned before, it is a free tool. We have had over 200,000 downloads of the app in over 140 countries. As I mentioned, there's no pop-ups, there's no advertisements. It's just a great tool for our expectant parents to use. And they do regularly survey to get feedback on improvements. You're going to have options that you can use this app if you have twins. You can track future pregnancies on the same profile, and you can manage multiple devices with the same account. So if you can see on your screen, this app is available in 16 different languages on Apple and Android products. Users can restart a session, they can delete a kick. I like to mention, I know some of our expectant parents who use this really get their family members involved. For example, like my sister-in-law, when she was tracking her baby's movements, she had one of her daughters help. And sometimes, you know, toddlers would feel the kick, and it's just fun to tap that little kick, that little foot. So they click a couple too many times. So you can restart your session, you can delete a kick, but it's a really nice bonding experience, not just for expectant parent with your baby, but also to get maybe siblings involved or to get the expectant partner involved as well. And in the app, you have the option of having daily reminders. So if a parent forgets, they're busy, they'll get a little alert, a notification on their phone that it's time to start their kick counts for the day. So there's some really great features. You can review your kick counting history. You can bring that history to your next appointment with your provider. You can share that kick counting history with friends and family if you wanted. And so let's actually talk about how the app works. You saw in the video a little sneak preview. But on the left side of your screen, you'll see that little foot. So when they're starting a kick counting session, they're going to tap that foot and one of those little sections will get highlighted. Eventually they get to 10 and the app keeps track of how long it took to get to 10 counts. And over time, they should start to see a nice trend line. So that second picture from the left, you'll see that graph that tends to be somewhat linear in nature. It's going to be relatively stable. If our parent sees any strong deviation from that linear stable track, that's when they would reach out to their provider and get some guidance from their provider on how to continue forward. One of the other newest features, as you saw on the video, is that after they track their time, the app will ask them to gauge what their movement strength is. So from fluttery to fierce. So let's say they typically think on a scale of 1 to 5, they're usually around a 2, and all of a sudden in their kick counting session, it's a 5. There's a significant change in strength. That might be an indication, maybe baby's in fetal distress. That's a good time for parents to speak up and call their provider. So all of these features are free on the phone, but they're also available on the Apple Watch. And so, for very busy parents, sometimes they're on the go. Sometimes they're laying down and putting, a sibling to bed, so they can actually do their kick counting from their phone. And then our newest feature is that you can also do it straight from a desktop. Let's say you're at work and you're not allowed to use your phone at work. If your normal kick counting time is going to be during, so at some point when you're taking your lunch, something like that, you can actually use either your phone, your Apple Watch, or your desktop, and it's all integrated into the same account. All right, so after the first few kicks, the app is actually going to have the user take a survey, and this is very specifically created for Florida. And what we're trying to do is positively impact some social determinants of health. So they're going to ask questions about whether the parent is feeling their best, whether they feel like they have resources, do they have some needs in their life. You can see the question in the middle. If you're feeling sad or upset, do you feel like you have healthy coping skills? And the really important part to this is that last question on the right, and there are lots more questions. We're only showing you a few snippets, but if you answered no to any of the questions, there is a direct link here to Florida Family Health Line and some resources that would be available to our parents. So that is actually one of our newest features also.
Yeah, and I'll just add, it's completely voluntary too. They can skip it. They don't have to answer it, but we do have a pretty good response rate. And then it's connecting people directly to those resources like Jennifer said. All right, thanks Jennifer for all of that great information. I've been answering some questions in the chat about the app too. So now that you've downloaded it, you're using it. Let's talk about how you can talk about this with your expectant parents. The first thing that I want to address though is that when you have these conversations with your parents, that you're also addressing health literacy. We know that health literacy is one of the strongest indicators of the individual's health status. So here are 5 ways to improve that conversation that you're having with your expectant parents. Of course, we want you to be equitable. You're avoiding assumptions and provide this information to all expectant parents, no matter their race, their gender, their religion, sexual orientation, marital status, educational level. It's all the same information that goes for if they're considered high risk. You start having this conversation at 26 weeks or not. Every expectant parent needs this information. So 26, 27, 28 weeks, that's when you want to start having this conversation. You're listening and you're learning. You're asking strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. Things like, tell me what you know about your baby movement. What do you know about kick counting? What questions do you have about your baby's movements? Being clear and concise, avoiding long or complex explanations and medical terminology. Jennifer and I have been using the term fetal movement monitoring quite a bit during this presentation, but that's not something I would say if I was doing a presentation to expectant parents, right? You'd be talking about your baby's movements, your baby's kicks, those pushes, those shoves, that type of thing. And then being honest, everybody deserves to know about this, speaking the truth while still practicing empathy and compassion. Reteach, if the patient displays confusion or lack of understanding, making sure to correct and clarify, providing extra support. This is why I want you to address this and talk about Count the Kicks every single touch point you have with somebody. You might see them, if you're in a WIC clinic, let's say you see them at 27 weeks and you're not going to see them again until 32 weeks pregnant. I still want you to talk to them about it at 32 weeks, just like you did at 27 weeks. As many touch points we can have with expectant parents, the better. What about talking to people about stillbirth? You might be thinking things like, I don't want to scare expectant parents. And I think it's really important to note that pregnancy is full of risks that we talk to expectant parents about. Stillbirth is another risk that expectant parents deserve to be educated about. Stillbirth just happens, there's nothing we can do, but there are warning signs, just like Jennifer has mentioned earlier and with her own experience, if expectant parents know what to look for. My baby's always active, it's not a concern. I guarantee you are going to get told this multiple times when you're talking to your expectant parents. And so we address it here in the next slide again too. And I always say the same thing. I always say, that's awesome. A healthy baby is an active baby. However, cord and placental complications can be sudden. So we really want you to track to see what's normal for your baby so you can pick up on a change. And like Jennifer said earlier, pregnancy brain is a real thing. Like, we are busy, so it takes the guesswork out of doing that. And I'm almost at my due date. The risk of stillbirth actually increases as an expectant parent approaches or exceeds their due date. So going through some common myths, Jennifer and I are going to do a little bit of role playing. So Jennifer, you're going to be the patient, the pregnant mama, and I'll be your provider or doula or midwife.
Thank you. And I will say most of these I have heard or thought about from parents or when I was pregnant myself. So the first one, if you could give us the facts behind this, sometimes I hear, okay, my baby's always active. I don't really need to count kicks because I can feel them move all the time.
Right. Yeah. And this just goes into that, like, a healthy baby is an active baby. It's still really important to know if our normally active baby has slowed down.
What about the idea that only high-risk pregnancies need to pay attention to baby's movement?
We want all expectant parents to be educated on Count the Kicks. So we don't just do the gestational diabetes test for those that might be at higher risk. We do that for everybody. Same with this. You should be talking about Count the Kicks and fetal movement monitoring with every single expectant parent you interact with.
So this is actually the one that hits home the most for me because I had always heard 10 kicks in 2 hours. But I know that my baby's normal was actually very different from other people's baby's normal. So can you talk about that one?
Yeah, this is a common one that we hear a lot. I think it's really easy to say and remember 10 and 2 or 10 and 1. And I think you hit the nail on the head when you said every baby's different, right? Like, your pregnancy is different than a friend's pregnancy. The recommendation to expect 10 kicks in 2 hours is outdated. And we have research on this. It's on our website. Basically what it says is that we really want expectant parents to understand what's normal for their baby to get to 10 movements. So that way, that's what they're focused on. So when we say things like 10 and 2, and as individuals and humans, we focus so much on that time. So if I've been counting, and I've been counting for the last 2 weeks, and I normally get 10 movements in 15 minutes, I've been counting around the same time every day. And one day I count and it takes my baby an hour and 15 minutes, for example. What happens, one, if you're using the app, the graph changes visually, but two, if I think to myself, well, my provider, or I heard, or I saw on Google, whatever, I should still get 10 kicks in 2 hours, I'm fine. But really, my baby's normal has been 15 minutes for 10 movements. So that isn't my baby's normal when I get an hour and 15 minutes. So I suggest reading that research study on there that really goes into more detail about it, but it's really about getting to know what's normal for your baby.
What about if a parent wants to use a Doppler device to monitor their baby's well-being from home?
Sure. And I know this was I know you can download apps. I know this was common, especially in the height of the pandemic when appointments were getting stretched out. I think it's really important to note that a change of baby's heartbeat is one of the last things to occur when a baby's in distress, whereas a change in baby's movement may indicate potential problems before the actual change in heart rate. We really don't want people to use a Doppler device unless they're under the guidance of a healthcare provider. Plus, it's very difficult to or easy, I guess, to hear your own heartbeat thinking it's the baby's. And even when you go in with a change in fetal movement, providers are not just doing a Doppler device and sending you on their way. They should be doing additional testing and things like that. So we really don't want people to be using a Doppler device to make sure baby's okay.
If baby isn't moving, I know I did this actually the morning that I went into the hospital. I drank cold water and I ate something sugary, and then I sat and waited for a little bit.
Yeah. And so again, this is similar to that 10 and 2, right? Research has been moving away from the idea that sugary drinks and the like are a good way to get baby to move. We know, and research shows, that kick counts are best monitored without interventions like juice or candy. If a baby's not moving like normal, parents should speak up to their provider right away. Because if you think about it, it's just like when you and I are sick. When we're sick, we're resting, we're conserving energy, we're sleeping, we're lying on the couch, we're not chugging Mountain Dew, we're not eating a bunch of Snickers bars to get our energy up, we're resting. Same with baby in utero. If something's going on with baby, whether it's a cord issue, infection, low amniotic fluid, something is changing their movement. So why are we trying to force baby to move if it's not what they regularly do?
Is it true that babies do kick less near the end of the pregnancy?
Babies don't run out of room. You know, everything grows, right? But it's important, especially with those first time moms, to talk through the types of movement may change. It might be more jabs versus fewer of those, you know, huge body rolls where they're like literally changing position. But we know, you all know this, babies move up to and during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should still take about the same amount of time to get to 10 movements, whether it's at 28 weeks or 32 weeks or 38 weeks. You're still getting around the same type of movement in the same amount of time.
All right, so what about pregnant people avoiding dental care?
Please encourage your parents to go to the dentist. Those preventative visits for the oral health is really, really important. So there's a lot connected there. So we have a whole webpage dedicated to that as well. Oh, I skipped ahead. Sorry. Triage.
That's okay.
I got a little clip happy there. Yes, if I have any labor and delivery nurses on here, if I have triage, please order and share this information. That's the perfect time to have this. I went to triage 3 different times with my daughter thinking I had reduced fetal movement. And so I think it's really important to have that. We'll talk about some integration here in a minute of how to have the after visit summary form and integrate that into your workflow that way. So everything checked out with my daughter fine. Everything was good. She's now 7. But yeah, I went because I didn't know what her normal was. I was comparing her to my other child. I was comparing her to my friend's pregnancies. So I did not have this education at the time of her birth. So let's talk really quickly. I know we have about 10 minutes left, but we have some more fun interactive things to do here too. But thinking through systems change, and I would love to have offline conversations with you. This is what I'm really passionate about. Hopefully you've been thinking too how you can integrate this into your discharge paperwork, your after visit summary, or your WIC family care plans, or your home visiting, tracking when somebody's pregnant and when you should start talking about this. There's a lot of different ways that you can integrate this. The most important is that you're talking about it, right? You're putting the brochures out, you're passing them out, you're putting them in the restrooms. If you are a medical provider, the perfect time to talk about this is right at that glucose test, right? I think in Iowa, well, at least I did, I had to take that glucose test in front of a nurse and sit there for an hour. What a perfect opportunity to say, hey, here's a brochure, I want you to read it, download the app, and then let's talk about it. Integration into your EMR, EHRs. Could you add a pop-up where it says they're in their 3rd trimester? Did you talk about fetal movement? Could you add a voicemail to remind people to talk about, to count their baby's movements? Add that recording. There's a lot of different ways you can do this. This is what we consider our gold standard after visit summary. I'm happy to send this to you and talk to you more about it if this would fit your needs. So if somebody comes in and they get sent home, you know, and everything checks out fine, this is what some health systems are integrating. We have several health systems who are adding this into their after visit summary. They have how to talk about it, how to explain it to their parents, and then a QR code. Jennifer, okay. I think we should play the song though. Like, let's do it. Let's let people do it.
I think so too. I'm so glad you're saying that. Okay. So this is one of my favorite parts of the presentation. We actually want you to order materials right now. So you can do that in one of 2 ways. So in a moment, Megan's going to play a song. We're going to give you a few minutes to do this, but there is a QR code on the bottom left side of your screen. So if you've got your phone, you can aim your phone at that QR code and it will send you directly to the link where you can go to order your materials. There is also the website, counttthekicks.org, if you're sitting at a desktop. And when you go in there at the top, one of the options is order materials. So I'm going to talk a little bit more about what you can pull from there. But it's things like promotional posters, how-to posters that you can hang in your office, app card reminders to send home with your parents, brochures. We've got at-a-glance materials, magnets, and then you can see the 4 languages that we have here in Florida. So if you could, Megan, go ahead and play that song, and folks at home, I want you to please go on right now and order your materials, because as soon as this webinar is over, I know you're going back to your patients and you are very busy. So we're gonna give you a couple minutes to do it here.
Yeah, and you're gonna be entered in to win a gift card too if you place an order today. So don't go away. We have just a couple things to wrap up with, so let's listen. It takes a second. Oops. I promise it's going to play. If I could actually hit play.
It might seem crazy what I'm about to say.
think we'll keep going, but keep multitasking. I know we're all multitaskers, and I want to make sure we get out on time and address those questions that we have too. So yes, go order the material, put them up in your restrooms, your waiting rooms, have them in your car. You guys are the boots on the ground. You're the ones that are going to be able to share this with your pregnant individuals that you work with. So keep some in your car, drop them off at a library, drop them off when you can at various locations. So Jennifer, do you want to talk about a couple more resources? And then we'll wrap up with those questions I see in the chat.
Yes, absolutely. So we do have a continuing education training. It's worth 2.25 CEs. And this is training healthcare professionals on how to talk to their parents about fetal monitoring, what kind of best practices to use. It goes a lot more in depth than what we did today. We're kind of giving you the crash course. You get to learn about some of the research, and they give lots of suggestions on how to implement this within your organization. So that QR code right there is how you can enroll in one of our classes. Again, this is free. It is sponsored by the Florida Department of Health, and your registration code is right there, Save Babies Florida, and that means that you will not have to pay to attend this. But everybody needs continuing education training usually. So.
And we'll send out the link too in that email. You'll get a great email full of great resources.
Yes. And then on this screen, you can see two different things. So on the right side, that is the Count the Kicks information that's on the Florida Department of Health's website. And it sends you to tons of different resources and some direct links to the Count the Kicks page. On the left side, I know Megan's going to send the link to this. It's actually data reports about Florida's use of Count the Kicks, how many materials have been ordered, things like that. So she's going to send that out to you guys.
Yep.
All right, so what is an ambassador's role? I briefly mentioned it in the beginning, but we have ambassadors throughout. I think we've got 38 states now. We have ambassadors, and we are here to advocate for expectant parents and for babies. And we are all here most likely due to a personal experience. We have a lot of stillbirth parents. We have a lot of baby saved parents. We have a lot of doulas and midwives, people that are at the front lines with our expectant parents. And so what do? We attend conferences, baby fairs, community baby showers. We give media interviews, and we just work to grow partnerships within our state. And of course, the most important thing is support you with whatever needs you have. Okay, so what are you going to do when you leave this webinar today? We want you to familiarize yourself with this Count the Kicks app. Hopefully you just downloaded it, practice, practice, practice. So it's really easy for you to show your parent how easy it is to use. We want you to order Count the Kicks materials. Fill that cart. If you haven't done it already, fill the cart, get the address in there, and get those materials out to you. We recommend that you pick one person in your office to kind of oversee ordering materials. Keep track when you're running low so you can get restocked before you actually run out. And then take the time to educate your parents. Make sure that they have a conversation with you at every single touch point about kick counting. And I want to mention, Megan mentioned it earlier, but not just asking the question, is baby moving? Because that's like a yes, no answer, but asking very open-ended questions. Tell me about your kick counting tracking. Tell me about baby's movement. And you're going to get a lot more information from your expectant parent than just maybe a yes or no question. And then, of course, make sure your entire staff knows about this public health campaign. Make sure they know about using the app and how important it is. You want to debunk the myths. Make sure they're not believing the 10 kicks 2 hours, and make sure that they know speaking up is okay. And of course, this very last one is really important, especially for us stillbirth parents, is that hours matter, minutes matter in terms of saving babies. So we want to make sure our patients and our staff know that it is really important that we expedite concerns about movement. If we think patients should go directly to labor and delivery, then we make sure that patients know to speak up and advocate for themselves.
And then I'll just add too, really quick, we have one more video to share about baby Nala, but we also are hosting a Spanish baby shower. So a virtual baby shower in Spanish that will talk about Count the Kicks, labor and delivery, what to expect. I will be sending that out in the email too for you. So if you have any Spanish speaking individuals that want to attend, it's going to be a great event. It's virtual. It's just in a couple weeks. So I'll be sure to share that. And then later on in the year in May, we'll also be doing a Spanish or a Haitian Creole baby shower, a virtual baby shower in Haitian Creole. So we're super excited about bringing those resources too. And then as we wrap up, we have one more video to share of why do we do this?
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention to count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So I like what she says at the end there about go check on your baby. Don't worry about this. Don't worry about that. Go check on your baby. So yeah, I'll just wrap up, Jennifer. This is our social media accounts. Feel free to follow us, share, reshare, retweet, sign up for our newsletter so you know when that web-based kick counter goes live. It should be any day now. And with that, we're happy to answer any questions. I'll double check the chat. Let's see here. Yes, I'll save the chat. So some of those, I will send out the information on the baby shower. I did want to address, somebody had asked about how racism plays a factor into this. And I think it's important to note that we know that racism impacts birth outcomes for mom and baby, and that years and years of systemic racism has created implicit biases and limited access within areas like education, housing, even healthcare. And we know that implicit bias can lead to some doctors being dismissive of women of color. And so ACOG also points to this too as being a risk factor for birth outcomes. So
Megan,
what other,
can I just add to that? I know you addressed it in one of the slides, but just making sure that we talk to all of our patients the exact same way. Regardless of race, regardless, I'll put my video on, regardless of how many babies they've had. So even if this is their 5th baby, don't assume that they know how to kick counts. If it's their 1st baby or their 5th baby, have the same conversations with everyone. Even if you talk to them at the last appointment, talk to them the same way.
Yes. And so, okay, we'll answer any questions. I know we're a couple minutes over, so you can stay on. I'm going to keep recording because this will be sent out too. Somebody had asked, do you guys offer any help for moms that have had a stillbirth? On our app, there is a resource that is, it's called RTZ Hope, where you can go and find, you know, search local resources and things like that, but we're not bereavement. So, but I know, Jennifer, you might have more information on this too, if you wanted to add any more, especially local in Florida.
Yeah, our RTZ is great. It's return to zero. Yeah, they have a lot of virtual support groups for parents. It's all free. They have in-person support groups as well. And yes, there's tons of bereavement resources out there. So maybe we'll have Megan include some of that in the follow-up email.
Yeah. And that was Beyond Pregnancy that asked that. So you can always reach out to us too for additional, like we can send you and Jennifer can help with that too. And somebody had asked, so the app records it and can share the app. Yes, you can. So the app gives you that data. So you can download all of your kick session histories that you've had and take it to your next appointment. You can download it and send it into a MyChart. You can take a screenshot of it. So it's all right there. So that gives them that, you know, that highly educated now person that says, look, this is the data. This is how I know my baby's not moving like normal or is moving. You know, we want to encourage our parents to speak up to providers about it too. What other questions did I miss? Or maybe they got answered. Yeah, that's a great question about the magnet. Right now it isn't English, but let me take that back to the team at the Florida Department of Health and see what we can do about that for next contract. So the magnet, Spanish.
Carla, I saw your request on there. Yes, we will send the baby shower information to you for sure.
Yeah, the baby shower is going to be fun and exciting. What other questions? Thanks, Esmeralda. Thanks for coming, everybody. Feel free to jump off. I'll stay on for a couple more minutes. Let me see. I'm just scrolling back to see.
Yes, and James, absolutely, we can get dads involved. This is a great way for dad to contribute. Sometimes they don't get to do all the fun stuff that the moms get to do, but this is one way that you can be a part of tracking those baby fetal movements.
Yeah.
Maybe in the beginning, it's not as easy to feel them on the outside. Mom can feel them a little bit better from the inside, but eventually you get to that point where you can feel them on the outside.
Well, a lot of times, because you can share an account, right, on the app. So dad can log in and see how baby's been moving. And when back in the day, before COVID, when we did in-person baby shows and things like that, it was usually the partner that would come up to us and say, what is this? How can I be part of this? So it was really cool. Thanks for all the kind comments, everybody. Somebody said, I understand some dentists won't see pregnant people. That's really unfortunate. Hopefully those individuals can find somebody that will see them for oral health care during their pregnancy. Let's see. Fathers can use this. I see James's comment now. I'm sharing the chat too. So if I miss anything, I'll go back and make sure I answer it and send you guys an email. So yeah, final thank you to everybody that stayed on. I know we're a couple minutes late, but we really do appreciate it and really appreciate Florida Department of Health for working with us and partnering with us on this important mission. This education and outreach is really important to us. So I'm going to stop recording.